It's time for give birth. It's time for you to give birth. It's time for you to give birth. Sign of labor. Sign of labor. There are no signs of labor yet. There are no signs of labor yet. It's time for you to give birth, but there are no signs of labor yet. It's time for you to give birth, but there are no signs of labor yet. Stimulate. Stimulate. Place a Foley bag. Place a Foley bag. Cervical canal. Cervical canal. By placing a Foley bag in your cervical canal. By placing a Foley bag in your cervical canal. So we have to stimulate it by placing a Foley bag in your cervical canal. So we have to stimulate it by placing a Foley bag in your cervical canal. Stay in bed. The Foley bag ejects. The Foley bag ejects. You have to stay in bed until the Foley bag ejects. You have to stay in bed until the bag ejects. After 12 hours, if it doesn't come out, the nurse will get it out. After 12 hours, if it doesn't come out, the nurse will get it out. Signs of labor. Delivery room. Delivery room. If there are signs of labor, you will be taken to the delivery room. If there are signs of labor, you will be taken to the delivery room. Perennial. Perennial. Numb. Numb. Still feel pain. Try to suffer it. Try to suffer it. Dose. Dose. The dose is enough. The dose is enough. Numb you more. Numb you more. I've numbed your perennial. If you still feel pain, you have to try to suffer it. The dose is enough. I can't numb you more. I've numbed your perennial. If you still feel pain, you have to try to suffer it. The dose is enough. I can't numb you more. Push. Push hard. Push harder. Try to breathe. Try to breathe. Breathe slowly. Breathe deeply. Try to breathe slowly and deeply. Hold the bed tightly, tightly, tightly. Hold the bed tightly. Have enough money. Feel numb enough. Feel numb enough. Do you feel numb enough yet? Did you feel numb enough yet? Placenta. Placenta. I have to take the placenta out. I have to take the placenta out. Suture. Suture. Heal well. Heal well. The suture heals well. The suture heals well. Numb the perennial. Numb the perennial. Suture. Stop bleeding. To stop bleeding. In order to stop bleeding. In order not to feel pain. In order not to feel pain. So that you don't feel pain. So that you don't feel pain. I have to numb your perennial so that you don't feel pain when I suture it. I have to numb your perennial so that you don't feel pain when I suture it. The baby's come out. Congratulations. Congratulations. The baby's come out. Congratulations. Have examination. Have regular examination. During pregnancy. Have regular examination during pregnancy. It's very important to have regular examination during your pregnancy. Lie down. Legs apart. Legs apart. Lie down, legs apart. Lie down, legs apart. Move upward. Move upward. Move downward. Move downward. A little bit. Move upward a little bit. Move downward a little bit. Temperature. Take your temperature. Take your temperature. Take, took, taken. Has the nurse taken your temperature yet? Has the nurse taken your temperature yet? Did the nurse take your temperature yet? Did the nurse take your temperature yet? Blood pressure. Take your blood pressure. Take your blood pressure. Has the nurse taken your blood pressure yet? Has the nurse taken your blood pressure yet? Did the nurse take your blood pressure yet? Did the nurse take your blood pressure yet? Breast milk. Breast milk. Breastfeed the baby. Breastfeed the baby. Feed the baby with breast milk. Feed the baby with breast milk. For at least 6 months. For at least 6 months. Breastfeed the baby for at least 6 months. Feed the baby with breast milk for at least 6 months. Breastfeeding. Breastfeeding. Breastfeeding is very important. Breastfeeding is very important. Feed the baby with formula milk. Feed the baby with formula milk. Disease, disease. Transmit, transmit. Sexual, sexual. Sexually transmitted, sexually transmitted. Sexually transmitted diseases, sexually transmitted diseases. Have bleeding, have vaginal bleeding, have vaginal bleeding. During sex, during sexual intercourse, during sexual intercourse. Have vaginal bleeding during sex. Have vaginal bleeding during sexual intercourse. Abnormal. Have abnormal vaginal bleeding. Have abnormal vaginal bleeding. Nausea, nausea. Feel nauseous, feel nauseous. Feel dizzy, feel dizzy. Dizziness, dizziness. Don't push anymore, don't push anymore. Stop pushing, stop pushing. Blood. Have a blood test, have a blood test. Urine. Have a urine test, have a urine test. Have ultrasound, have ultrasound. Have a smear test, have a pap smear. Vaginal discharge, vaginal discharge, discharge. It smells, it smells. It's smelly, it's smelly. It's frothy, it's frothy, frothy. It's yellowish, it's yellowish. It's brownish, brownish. It's inflamed, it's inflamed. Inflammation, inflammation. It's infected, it's infected. Infection, infection. HIV, human immune virus, human immune virus. Get infected with HIV. To be infected with HIV. I'm infected with HIV. I'm infected with HIV. Medicine. Take medicine. Antibiotic. Take antibiotic. Pulse rate, pulse rate. Feel the pulse, feel your pulse. Cervix, cervix, cervix. Cervical, cervical. Cervical cancer, cervical cancer. Detect, detect. It helps to detect. It helps to detect. At an early stage. At an early stage. It helps to detect cervical cancer at an early stage. It helps to detect cervical cancer at an early stage. Treatment, treatment. Have treatment. Antibiotic. Have antibiotic treatment. Have antibiotic treatment. You must have antibiotic treatment. You must have antibiotic treatment. Too salty, too salty. Too sweet, too sweet. The food that is too sweet or too salty. The food that is too sweet or too salty. Don't eat the food that is too salty. Don't eat the food that is too salty. Have waters breaking. Have waters breaking. Call the nurse. Urine. Urinate. Piss. Bowel. Empty. Empty your bowels. Date of delivery. Expect. Expected date of delivery. Expected date of delivery. 2 meters longer. 5 days later. It's 5 days later than the expected date of delivery. It's 5 days later than the expected date of delivery. Feel like doing something. Feel like having bowel movements. Embrace the baby on your chest. Embrace. Embrace the baby on your chest. Keep the baby warm. Make the emotion between the mother and the baby closer. Make the emotion between the mother and the baby closer. I finished it. I finished it. I'm going to finish it. The cervix is dilating. The cervix is dilating. The cervix has dilated to 5 centimeters. The cervix has dilated to 5 centimeters. I'm on maternity leave. I'm on maternity leave. I'm on sick leave. I'm on sick leave. Have painless delivery. Have painless delivery. Contraction. The contractions are not close enough to cause labor. The contractions are not close enough to cause labor. The number of contractions isn't enough to cause labor. The number of contractions isn't enough to cause labor. Give me your arm for injection. Give me your arm for injection. Sit up. Sit up. Give you injection in the spinal cord. Spinal cord. Give you injection in the spinal cord. The contractions are getting closer. The contractions are 5 minutes apart. Too much amniotic fluid. Too little amniotic fluid. Have premature birth. Have premature birth. Have breech birth. Have breech birth. Have vaginal delivery. Have vaginal delivery. Have cesarean section. Have cesarean section. Where's the pain? To be in pain. How long have you been in pain? How is it? What is it like? How is your pain? What's your pain like? Describe. Can you describe your pain? It's dull pain. Sharp shooting pain. Temporal. Labor pain. Abdominal. Lower abdominal. Lower abdominal pain. Lower abdominal pain. Movement. Fetal movement. Pain from fetal movement. Pain from fetal movement. Is mistaken for. Is mistaken for. Is mistaken for pain from fetal movement. Is mistaken pain. Is mistaken for pain from fetal movement.